それでは始めさせていただきます。
Thank you very much for waiting. We would like to open the program now. Thank you very much for coming to join us. We would now like to open the World AIDS Day Special Symposium on the front lines in the fight against deadly disease, Global Momentum from the Ground Up. This is organized by IDE-JETRO as well as JCIE and the Friends of the Global Fund Japan. To start with, on behalf of the organizers, I would like to call upon President and CEO of JCIE, Ken Shibusawa, to give you a welcoming address.
Good
afternoon, ladies and gentlemen. Thank you very much for the introduction. My name is Shibusawa, President of JCIE. Thank you very much indeed for coming out to join us out of your busy schedules. We are co-organizing this event with IDE-JETRO, and it's a great pleasure and honor for us to be able to have Dr. Peter Piot as the speaker today. We have two objectives in this symposium. One is to commemorate the publication of the book written by Dr. Piot. This is a memoir that was published in May of this year. The title of the book is No Time to Lose: A Life in Pursuit of Deadly Viruses. That's the title of the book. I have read this book myself, and this is a book written by a physician, and I was interested what it's about, but it's as if it is a novel, and it was very, very exciting. It was a page turner. On page 6, he talks about a conversation that he had with his professor in 1974. And the professor says that there is no future in infectious diseases. And the reason is because all the infectious diseases have all been solved. That is what he writes in the book. And Peter says that he ignored him. And because he ignored the advice of his professor, I think thanks to that, several million people have been able to prolong their lives, thanks to his decision to ignore his professor. Now, in part 2, we will be talking about corporations' efforts. The fight against the viruses. How can corporations, the corporate sector, can contribute? That is going to be what we will be talking about in the second part. What is the impact that AIDS is having on business in Africa? How are corporations dealing with the issue of AIDS? We will have presentations from two speakers. First speaker is Dr. Damien Duwalk from the World Bank, and the second speaker would be Mr. Mr. Seiro Ito from IDE-JETRO. Now, Dr. Piot, he loves Japan. Maybe this is an exaggeration, but he has been coming to Japan for several years now, and according to what we hear, he writes in this book actually. He knows Shimbashi area very well, and tomorrow night if you go to Shimbashi, it could be that you might have a chance meeting with Dr. Piot. On Saturday, he arrived in Japan, and at Keio University, there was the Japanese Society for AIDS Research Conference, and he also spoke at Nagasaki University as well as Kyoto University, and today he just got back from Kyoto. I would like to thank Dr. Piot for coming to speak at our symposium out of his very, very busy schedule. He will speak for about 30 minutes initially, and after that we will have a dialogue with the director of News and Production Division of NHK. She is an international journalist who has been engaged on this issue of AIDS for many years. So there's going to be a talk session with Ms. Omura. As you know, 1st of December is World AIDS Day. On such a day, what can we do as Japanese? How can we contribute to this issue of AIDS? I think this is going to serve as a great opportunity to think about this together. So, Peter?
Please. Thank you so much, Ken, Usawa, and good evening, everybody. Good afternoon. It's a real pleasure to be here in Tokyo and to see so many friends again, and also to spend a week in, here in Japan. Also because Japan has played a very important role in the fight against AIDS internationally. And be it from the creation of the Global Fund, which was conceived at the G8 session, the G8 summit in Kyushu, Okinawa in 2000, and to the support and from the funding, the Global Fund, and of course also the leadership of civil society. So it's always a pleasure to be here. Now, I would like to say a few words about this book. I never thought I would live long enough to write memoirs, but then I decided to write them before I have forgotten everything, and also to put things in perspective. So when I left the UNAIDS, and that is now nearly 4 years ago, I started collecting all the information, because my memory is not good enough to do this by heart. And I thought that it would be important to put in perspective the enormous progress that we have made, not only in the fight against AIDS, but also in global cooperation. But also that such progress doesn't fall out of the sky. It requires enormous efforts of many, many people in different parts of society. And that's also when you look at the index of this book, at the end, it's only names of people. Because I want to pay tribute to all the people who together make up the AIDS movement. Because if we've been successful to a certain degree, the fight against AIDS, it's because there was a global movement. There is a global movement made out of thousands and thousands and thousands of people in about every single country in the world, also in Japan. And you'll find a number of Japanese friends and colleagues who are mentioned in the book, not only in Shimbasu area, but also because of the work they've been doing. Now, as you heard from Shibusawa-san, when I was at the end of my medical school, my medical studies, I wanted to study infectious diseases. I wanted to work in and with developing countries and health of poor people, but nearly all my professors said, no future, it's finished. It's all solved because we have vaccines, we have antibiotics. But one, I'm a pretty stubborn person, so I don't give up very easily. But also, I was fundamentally convinced they were wrong. But thirdly, I also think that in life you have to do what you really would like to do and what you enjoy doing, because that's what you will do well, and not because the market says that we no longer need people who know about infectious diseases. And so less than 2 years after graduating from medical school, I was involved in the discovery of a new virus, Ebola virus, which happens to be one of the most deadly viruses that we know. Deadly in the sense that basically 2 weeks after infection, over 95% of people are dead. Now, HIV infection is the same, but without treatment, you also die nearly 100%. It just takes 10 years, 15 years. And And that's actually for society even worse, in a sense. Because during these 10 years of healthy life, the virus can be transmitted to many, many other people. Whereas with Ebola, it dies out very rapidly because the virus kills the host. But for me, the discovery of that virus and the exciting adventure also of trying to understand how a new virus is transmitted, that told me that anything can happen. That was one of the first lessons in my life. Anything can happen, new viruses come. Who would have thought at the end of the 20th century, at the time of high technology and all kinds of new things, and the rise of diabetes and so on, that the world would be affected by a new virus, totally unknown until 1981, and which in the meantime has infected about 60 million people and killed over 25 million people. When you start thinking about it, it's quite something deep, a deep story about, about our human condition and about us, we people. Because all the 60 million people are connected with each other, by definition. Because they had sex with each other, they shared needles, or their mother had it, or got a blood transfusion or blood products, because there's no other way to transmit it. And one day I woke up and I had this vision, and I said, oh, it tells a story of us, human species, that we are so connected, but we don't know it. And a lot of that connectivity is underground. So what was exciting also about Ebola virus is that I was very lucky in a sense and very privileged that I could investigate a completely unknown epidemic, unknown virus. In our profession, when you have influenza epidemic or cholera or dengue or so, we know what to look for, we know how it's transmitted. But when you don't know, then it is like detective work. And I described that, and this is the adventures in the jungle of Africa. But a second lesson that I learned during these early days of the discovery of Ebola virus was that doing good is not enough and can even be dangerous. The first known outbreak of Ebola virus occurred in a mission hospital, a Catholic mission hospital in the center of what was then called Zaire in Central Africa, today the Democratic Republic of Congo. And the mission sisters did a lot of good work in education, ran a hospital and so on. Unfortunately, they did not have any professional solid training, and were not respecting fundamentals of hospital hygiene, and thereby, by giving injections without disinfecting and so on, with the same needle and syringe, they were responsible basically for the deaths of hundreds of people. Not that they wanted to do that, of course, I'm not suggesting that. So, important lesson for me is, it's important, of course, to want to do good for people, no doubt about that, that's why we're all here, but also you need solid professionalism. Now, after that epidemic, I became very interested in health in Africa, particularly, being from Belgium, that is the closest by, in a sense, and also because of our history, and particularly in the health of women, which was very, very neglected, still is, and under-researched, and so-called sexually transmitted infections. But then something happened that, again, was not in my career plan, which I never had anyway, and that is that we started seeing I was then back in Belgium after having spent some time in the United States, particularly in Seattle at the University of Washington, that we started seeing patients from Central Africa with a mysterious disease, and they all died. Were Africans, were also Europeans, and not only men but also women. And that was in 1980, 81, and then from the United States, the report came of this new disease, which was supposed to be a disease, a gay disease, a disease of homosexual men. But what we were seeing was clinically quite similar, not completely, but similar, but we also saw a lot of women with this disease. But the dogma was, it is a gay disease. Now, I never understood why a virus would care about the sexual orientation of its host, its human host. Because sex between two humans, from the perspective of a virus, is just a way of jumping from one person to another to, to prolong our life, to multiply. And it's just contact between mucosal surfaces. That's not very romantic, but that's how it is. And so I was also thinking, if in Belgium we see 100 people with this disease, which still had no name, there must be thousands in the country of origin, because who can afford to come to Europe for medical care? Either you have a lot of money, or it was high-ranking officials from the army and from government. So I went back to Kinshasa, the capital of Congo, and with my friends there from Congo and from the US, we investigated, we came and we saw within a few days that there was a problem. And this is something that I vividly remember as of today, and I would like to read about this in my book on page 131. When we went into the hospital, which I knew from 1976, when Ebola virus was hitting the capital, but only with a few people, we suddenly saw all these young men and women who were dying. And I read, "We all were silent and stared at each other. Then Capita," this is the doctor, who's the head of the internal medicine department, "then Capita opened the door into the women's pavilion, and we took a look at another huge ward that was overflowing with exactly the same thing. That morning we saw 50 or more cases of what we thought to be AIDS, though we still needed laboratory confirmation to be sure of our clinical impressions. And in 1983, so that's nearly 30 years ago, in 1983 that was a lot, because fewer than 2,000 cases had been reported worldwide, and a lot of those people were already dead. So when we got out of there, I took a deep breath, as I was nearly breathless. I remember it well, a physical sensation that was so strong, I wrote it down. It was not the happy, tingling energy of scientific discovery, which I also had known when we discovered the virus. There was curiosity, of course, and an urge to find some kind of solution, but also the overwhelming feeling that we were facing a truly momentous catastrophe. And I suddenly realized that this epidemic would take over my life. It was my aha moment. Aha, like in when you suddenly understand something. And in my mother tongue, Dutch, I wrote in my notebook, "Incredible, a catastrophe for Africa. This is what I want to work on. It will change everything." And it did change everything for me, but also for the people who are infected. And so for several years I was doing research, particularly in Congo, but also in Kenya, and in a few other countries in Africa, Burundi, Cote d'Ivoire, Senegal. And we documented that the situation was indeed very serious. It was expanding. But after a while, I was thinking, how long can I document the problem, this catastrophe that's getting worse and worse? I want to do something about it. I want to not only to study the world, but I want to change the world. And so I went to WHO, the World Health Organization, on a sabbatical leave, and to see how one can influence policy. And I also had become president of the International AIDS Society, which brings together AIDS scientists and of all kinds. Because what was happening is that, as I mentioned before, an AIDS movement was developing. And it was driven by activism, respect for human rights, and by the fact that people who were infected with HIV nearly uniformly died. So they were fighting for their life and fighting for more research to find a treatment and so on. And this is how I came many times to Japan. I'd been to Japan before, but in 1994, Yokohama hosted the first International AIDS Conference outside North America and Europe, Western Europe. And because I was president of the International AIDS Society, I worked with several of colleagues, both in the Ministry of Health and Welfare, but also in civil society and scientists and the Japanese NGOs for HIV prevention, to organize that conference, which was a challenge because Japan was not very familiar yet with this kind of issue, and also with all the activists who came. But it was a big success. We trained the staff of the hotels in Yokohama so that they would not discriminate against people and so on. But then the international community said that this AIDS epidemic is getting so big that we must do something about it that goes beyond the mandate of WHO. This is not only a medical problem, it's a problem for development, it affects productivity, and so on. And that's when UNAIDS was created, bringing together the AIDS efforts of many UN agencies and the World Bank. And so, to my surprise, in a sense, I was appointed as their first executive director. And suddenly I found myself in the jungle of international politics and international organizations. And that jungle is much worse than the jungle of Africa. Worse in the sense that it's more complicated. And I had, from the beginning, 5 goals, besides defeating this, in order to stop this epidemic. First of all, making sure we document very well what is the problem, where is the problem, who is affected, and so on. So that's the first point. Second point is that to find solutions. Because something that is a problem without a solution, nobody wants to work on, nobody wants to give money for, no politician wants to be associated with. And we did find solutions, or success, let's put it this way, progress in Thailand, which thanks to 100% condom use, had been successful in bringing down new infections. We also found it in a country like Uganda, where also the first results were obtained. So that was very important, and because we could say, if Thailand or if Uganda can have results, why can't everybody have it? Thirdly, we needed to build a coalition of all those who were committed to deal with this, because this is too big for one organization alone or for one group alone. And that coalition was also necessary because in these days, very few governments wanted to deal with AIDS in their own country, very few. So I read many times The Art of War by Sun Tzu, and said, if you can't go to the center, you encircle the center. And we organized many things, and finding champions in business, in AIDS activists, in certain governments and all that. And fourth, we must put this issue, AIDS, on the top of the world agenda. Because it's such a big thing and it requires so much money that we're not going to be able to deal with that without the top political commitment. And that happened, the turning point there was in 2001. We heard it was already discussed at the G8 summit, but then in 2001 there was a special session of the UN General Assembly, which was attended by 45 heads of state, presidents and prime ministers, and who agreed on a roadmap, so-called Declaration of Commitment. And I also was lucky to have a very supportive boss, Kofi Annan, then Secretary General of the UN. Also, the African presidents had a special summit and so on. And then lastly, you need money to do all this, and specific funding. And that's why we fought hard to create the global fund to fight AIDS, TB, malaria. And it's not only for AIDS, but also you hear tuberculosis and malaria, which have been around for many, many decades, centuries, but never been funded enough. Thanks to AIDS, they got now funding, the collateral benefit. So when all this came together, we still had one problem, and that is that for the treatment that appeared in 1996 on the market, we're giving 3 different pills. One could treat HIV, which changed completely the life of people with HIV. It was no longer a death sentence, but also it changed how we look at AIDS. It's something we can do something about. Even if it's not the solution, it's not stopping it. But that treatment costed in US dollars about $12,000 US per person per year in '96. So impossible for citizens from poor countries or poor citizens in countries where there's not good health care. And so I became very passionate about bringing down, lowering the price of antiretroviral drugs, anti-HIV drugs, which was complicated because these were new drugs under patent, and I didn't want to also kill the innovation. But to make a long story short, we succeeded in doing that, and it's described in the book. And so at some point in 2001, 2002, the stars were aligned. So there was a political effort in countries, there were programs, systems in place, the price of drugs had come down, there was a funding mechanism, and that's why we have now the achievements that were announced last week also by UNAIDS, and I'd like to end here. But I think the main lessons for me is that, first of all, that we can move mountains when there is a strong movement that involves many, many determined people from various walks of life, and that we should never accept the impossible. Secondly, that we must take a long-term view. If you're discouraged because you don't get results immediately, in medicine we say then you become a surgeon. You cut and it's there. And the patient is dead or is alive. So, but when you go into this kind of problems, you need a view that's decades maybe. And AIDS is not over. We will come back to that. So we'll need that. And thirdly is that we need leadership, we need science, we need the politics, we need the people engaged all together. one alone cannot make it. And I think also that AIDS has been transformational for international collaboration and for international development. Take the Global Fund. This is a new paradigm in international cooperation because it is bringing together governments, the private sector. It is a multilateral fund without being part of the United Nations and can move much faster. It is very much oriented towards transparency and results. And it's not perfect, but it has really resulted and it has saved millions of lives. And I think in today's world we are all looking for the best mechanisms to, to assist those in the world who are less fortunate than we are. But above all, I feel that I've been very lucky and privileged to be able to work on an issue like AIDS and other infectious diseases, and to have been privileged also to work with such fantastic people who together have made it possible. And that's what my book is dedicated to, all these people. For many times I was the spokesperson. I was also the one who got all the problems and got the blame for everything that was going wrong. But it is really that collective effort that made such a difference. And I think here also I'm very grateful to all the friends and colleagues in Japan and also the taxpayers of Japan, because when you think of it, that is also a fantastic paradigm shift, that people are willing to pay some of their taxes, maybe not always knowing it fully, but to pay to save the lives of people who are living very, very far away. And that, I think, is a great story of our 21st century, with all the problems there are today. So thank you very much for listening and your attention. Thank you.
Dr. Piot. Well, it's been almost 20 years since I participated in the AIDS conference in Yokohama. And it's nice to meet you for the first time in 20 years. And I think we see so many friends from the AIDS, so-called AIDS circle today. And I'm sure you're going to end up in Shimbashi tomorrow night. Before I start, I'd like to briefly introduce the book to the audience in Japanese, if you...
Yes, please.
When I was asked to read this book, I said, uh-oh, because this is a very thick book, a very voluminous book, so I wasn't sure whether I would be able to finish this book. That was my first impression, but as I read on, I realized that the first part, as Dr. Piot said earlier, he talks about his encounter with a mysterious virus. People were dying, and he was also concerned for his life. There was a time that he was also fearful for his own life. And this is a dangerous country. A helicopter crashed, and his acquaintance lost their lives through those accidents. So it was very thrilling. It was as if it's an adventure story. That was the first part. I thought that he went through so much difficulties in Africa and continued on with his research. I was very, very impressed. And also people living at the bottom of the society. He was in contact with such people as a physician on the ground. And he was actually really fighting against these deadly diseases. So that is what he writes about in the first half. This is as if it is a fiction novel rather than a book written by a physician. And the second half of this book, as you might know from the title, the headings, Well, The Sharks in the Water is one of the section title. I just wondered why it is titled in that way. And I read on and realized that he talks about bureaucracy or conceived notions. People feel that they are insulated from AIDS and stereotypes. He was fighting against all these things. He was not just fighting against the viruses, he was also fighting against many social barriers. That is what he writes about in the second half of this book. It is very, very raw and vivid, and I just wondered whether, can you really talk about this too? Behind the scenes stories, like how he worked in the UN and WHO, the struggles between these institutions. There was a lot of criticisms that he writes about. So I was a bit concerned whether it's really safe to write about these things in his book. But this is not like a book written by a scientist. This is a life story of Dr. Piot. Dr. Piot is from Belgium, but he writes in beautiful English. I was very, very impressed, and the expressions that he uses in his book. He writes about his true, honest feelings in very beautiful language, which was very, very beautiful, and I was very impressed. As an employee of NHK, I am not allowed to advertise anything, but this is off the record. This is a great book. I would like to put a plug in here. This is not available yet in Japanese, but I do hope that there is going to be a Japanese version to be published, because after reading this book, you can really understand the character and Dr. Piot in person.
Well, ever since the Yokohama conference, we haven't really established the full understanding of this disease yet. And well, after 30 years of unprecedented efforts of resources and efforts and resources, why is AIDS still a threat?
Well, first of all, Mura-san, good to see you. This is the second time that you interview me with 20 years in between, which is a real pleasure. And I would say that we are facing an incredibly complex issue, which goes to our existence itself. I mean, because it's related to sexuality and so on, but also to poverty, to inequalities, the position of women, discrimination of all kinds of population groups in many countries, from men who have sex with men to sex workers and so on. So it is far from over, but I would say also there's been enormous progress. And if I'm sometimes quite critical of international organizations, I also feel that without them we would not have seen the progress. But I fought against bureaucracy my whole life, and I will continue to do that to the last drop of breath, because I think we can do better. So there's been enormous progress, but it's far from over. And I think that the risk today is that there is complacency, because paradoxically, when there are results, we can think, okay, it's done. And there are so many problems in the world that we can then move the money and the efforts to something else. And I think that we can do better. We can do better with our investments to bring them there where the problem is. We can probably create more synergies, working together with, for example, to prevent mother-to-child transmission with mother and child health services and so on. But above all, we need to sustain the effort. We need to sustain the effort. That means also the money. And I would say that if we are declining our financial support, two things. More people will die, no doubt about that. Because these drugs and these efforts, they cost money, even if they're now much cheaper. But two, all the efforts that we've done before will be lost. It's an investment, and the investment will be lost.
Wow. Then what kind of role, what role can concerned parties like us play in fighting AIDS? Given Japan's strong corporate sector, what role can corporations play in the fight? Can you elaborate on that?
Yeah, I think, first of all, a general comment, and is that we live in a world where the global and the local are very, very connected. And so even if Japan itself, you don't have a big AIDS problem, but it's also growing here.
Yes.
There's no doubt about that. So it's not something that only exists far away. So that's why I think it's to the, you know, in the interest of Japan to deal with HIV at home and abroad, because it's contagious. But then I think also that, as I mentioned before, in the AIDS movement, many different parts of society have a very important role to play, and business is one of them. And the first duty, of course, of a business, besides making profit for the shareholders, is to take good care of the employees. There's a very strong tradition in Japan of that. And many Japanese companies are active overseas, including in countries with an AIDS problem. And for example, in the automobile industry, South Africa, Toyota is having plants there and is taking care of its employees with HIV prevention and care and so on. And that's particularly important in some low-income countries where there is not good health care outside the private sector. So that's one thing. Take good care of the employees. Secondly, it's the products that the companies make. Of course, we know about drugs. I mean, drugs, like HIV drugs, they're made by pharmaceutical companies and by the research. But also, this is not for AIDS, but for malaria, Sumitomo Chemicals. It's a Japanese company that is producing bed nets, producing them even in Tanzania. I visited a plant several years ago when it was opened. By having the production there, making sure it can be reached, can be available for people, that's a contribution. But also a completely different area in the communication industry. When I was in UNAIDS, we worked a lot with MTV, music television, because
Really?
yeah, because
Oh, yes.
we need to reach young people. Are you going to reach them with billboards and say AIDS kills? No, they laugh at it, and rightly so. So you need to use the, you know, what they look at, MTV and Facebook and all that, and the new media, and that's also business. So that's the second part. Thirdly, I would say is that from business we can learn and use some of the management practices and be more efficient. This is about taxpayers' money. This is about saving lives, and we need to make sure that the best possible management practices are followed for the best value for money, the best bang for the buck, as they say in America. So these are some examples, and then of course business are big players in society and can spread the message and say, this is affecting our bottom line. Therefore, we must deal with it. It's not only to do good.
Yes, maybe we have to continue the discussion in the second part of this symposium today about the corporations. Well, there is increasing evidence that non-communicable diseases are contributing more to burden of disease and to mortality than AIDS and other communicable diseases. And why is it still important to focus resources and energy on communicable diseases?
It is true that in most parts of the world that chronic diseases such as diabetes and cardiovascular disease, stroke, that cancers, they are responsible for the majority of deaths. But that's not the case in sub-Saharan Africa. In sub-Saharan Africa, AIDS is the #1 cause of death overall. And then malaria and tuberculosis also. And in a couple of weeks' time, there will be a new version of the so-called global burden of disease will be published. This is an exercise where scientists try to estimate what are people dying from, and what are the major causes of disability. And AIDS is there for 2010, number 5 and number 6 in the world. So it's not that it's over, and particularly sub-Saharan Africa, number 1 cause of death. Secondly, it's not one or the other. You know, we need to deal with both. But what I find very interesting is that in many countries, particularly low-income countries, AIDS was the first time that chronic care was offered to people. Even if hypertension and so on was already there for many years. And so in that case, the way that the model to deal with AIDS is a good model for dealing with other chronic diseases. So we can learn from each other. But thirdly, fourth point is that communicable diseases, by definition, are communicable, are contagious.
Yes.
So something that happens thousands of kilometers from here can have an impact on any country. We're all connected. And with travel and, you know, today it is in our interest, in the interest of any country, that communicable diseases are under control far away. Most dramatic example recently in recent years was with SARS and the flu. Okay, SARS killed a few hundred people. Less than people who fell off the stairs in that period in Asia. However, the economic cost of SARS was enormous. Tens of billions of, in whatever currency. And so again, it is, to use that jargon, it's a public good, a global public good, to deal with infectious diseases far away, to protect all of us. And I would say also we need to continue to invest in dealing with AIDS, TB and malaria, because also we've had results. It is so clear and actually quite unusual, but that we can say because of these investments, this funding, millions of people are alive today who would be dead. I mean, you can't think of anything better than that in terms of results. But also, setting up these systems took time, and so we need to continue to have the results. But I would be the first to admit that we need to create more synergies and work together.
Well, I'd like to quote your book that the history of AIDS brought out the best and the worst in human behavior. Could you tell us what you meant by this? This was my favorite phrase.
Okay. Yeah, I think so. In the sense, start with the worst and then to go to the best. So we remember the best. But we've seen in about every country in the world that people who are living with HIV lost their job, were denied even health care. So because doctors didn't want to treat people with HIV. I mean, that's not, a doctor is supposed to treat anybody. This is our responsibility, our duty. We saw priests who were kicking out people from their churches because they're HIV. They say, you're a sinner, you don't belong here. Whereas in religion, you want to involve and include everybody. We saw also people who were killed because they were HIV positive, particularly women. So all this exists, and that is also, and continues. I had always hoped that with the availability of treatment that we can say that AIDS is quote-unquote normalized, but it's still not the case. Because in people's mind it's often associated with doing something wrong. But the best I would say is the fact that something, I'll start with maybe what is a surprise, but I feel that, to use an old-fashioned word, international solidarity has worked in AIDS. I think that's a very strong example. As I said, that governments, taxpayers, people are willing to share some of their wealth and their, happiness and their fortune with others who suffer more. I think that's very good. And I've seen real heroes, particularly people living with HIV, who have dedicated their lives to it. I saw it also when I said that there are priests who kicked people out of their church, but I still remember very vividly in the 80s, I went to Thailand, to Chiang Mai in the north of Thailand, and where you could see the temples that were receiving the people who were dying from AIDS. The monks, and they were not scared then of touching people. So it is, But I think in general, with AIDS, things are no longer the same. Today, when a pharmaceutical company puts a new drug on the market against HIV, it immediately gives a price for the high-income countries, for Japan and Europe and so on, and one for the low-income countries. We had to fight very hard to get that. So there's also behavior change there. And I mentioned the Global Fund, so there are many things that have changed, and also particularly it's the first health problem where the people who are affected are playing an important role in the whole movement. And I think that's wonderful.
Well, the title of the book says, the subtitle says, A Life in Pursuit of Deadly Viruses. But you actually fought with bureaucracy and, social kind of barriers and people's stereotypes, things like that. And I was quite surprised that you acted like sometimes advocate or fundraiser, sometimes politician, sometimes, negotiator. And I wonder how you could, well, I'm adding one more extra question, but I wonder how you could just carry on this mission in this AIDS world. I mean, where did your energy come from? Was it love to Africa, or?
Well, first, the baseline of energy is pretty high to start with. But no, I would say that I'm not easily discouraged by something, because I said you need a long-term view. But also, I felt that this is one of the big problems of our time. When I was sometimes discouraged, that's true, because it was one step forward, two steps backwards, etc., I would always find my energy from the people living with HIV in the first place. I traveled a lot. I went, as I describe in my book, I went to see so many head of state, head of government, and I spent numerous hours in not always very interesting meetings, but but it had to push the agenda. And but I always insisted that I would have a meeting, and even after hours would have a drink and so with the people who are the activists, and they were giving me a hard time very often, that I'm not doing enough and so on. So it was sometimes not so easy for me. But then I thought, oh my boy, I'm so lucky, and I can also be their voice, and they gave me energy. But you have to be passionate about something, and certainly never take no for an answer. Just continue. But it was a very demanding job, that's for sure. But it's the publisher who added Life in Pursuit of Deadly Viruses. I didn't want that. But that's for the American market, The title, yes, that's...
Well, then what kind of advice do you give to, well, there are some young scientists here today. What kind of advice do you give to the scientists and doctors who want to just work in this field for communicable diseases?
Yeah, first I would say that the title of the book also indicates no time to lose. By that I meant, in the first place, that we wasted a lot of time when it came to fighting AIDS. You know, the Global Fund became operation 2002, 20 years ago. But that was 20 years after the beginning of AIDS. If we would have invested the same kind of money, the same energy in the beginning, it would have been not only millions of lives would have been saved, but also it would have been much cheaper. So, and that's a lesson for, I think, for other problems as well. So no time to lose, and it was also, you should not sit still. But for, I would say for scientists and, but of all kinds, not only those who are working in infectious diseases, that in the first place, do something that you're passionate about and do it well. But also keep in mind that this is about people and about saving lives. And then it depends what you like to do. I would say nothing can replace first-hand experience and working on the ground. Sometimes people come to me or students and they say, oh, I would like to work in a big international organization or whatever. I said, first work on the ground. Work in an NGO, work with the people in community. I think that is very important that you live with the people first. For scientists, I would say, do the good work. And you can do as useful work by studying a molecule which may lead to some new drug or vaccine or so. That's equally important. So there is not one path, one road that I can recommend. It depends where you are, what you can do, but always stay connected with people and think why you're doing this. This is what kept me going, that when you are in a boring meeting, you think, okay, I'm here because I want to defeat this epidemic, I want to save lives. And then you can smile, and you can say, yes, we go for it. Yes. And if they don't want this time, I come back next time. And so never give up.
Then it's been 20 years since we've started working on this epidemic. How would you evaluate Japan's efforts in the past? Or could you give us a mark?
Mark, no, but I said there are, Japan has played historically a very important role at the political level. As I said, at the conceiving or the planning for the Global Fund was done here, and was I think it was Prime Minister Hashimoto these days, and you know that was a very important step, and you have to look at it that way, and has contributed a lot of money. But I think that Japan could do more in terms of influencing the global scene, in terms of international cooperation. Japan punches a bit below its weight, in a sense. And it's not only about money, but you have a fantastic story to tell of your own society, how you're dealing with healthcare, how after the war, you build up the country and provided, you know, tuberculosis was a bad problem here. Maternal mortality, child mortality, malnutrition, and so on. And equality in access to health care. It's a story that gives you credibility, plus the science. This year's Nobel Prize Medicine, okay, Kyoto. You know, you had, it's from Japan. So there's a lot to offer, but I think now is key that the government continues these efforts. Because I think, you know, Japan has a lot of goodwill in the world, and it's through what you could call soft diplomacy that you can have real big influence. Influence that's good for other things, for business and political influence. And by putting money in the Global Fund, by you know, participating in this international effort, that gives you a lot of goodwill, and because that's what today, either you go for you can't send the Fifth Fleet and you don't want to do that. You're a peaceful nation. So it is through this kind of diplomacy and action that you can have influence. But I think you can do more, that's for sure.
But what more?
We can all do more.
Yeah, but what can we do more?
Well, I think the first is that not only is to honor the commitments, the financial commitments of that the successive governments have made. And it should not depend on who is in power for these international commitments. I think that is very important. And then also through the various Japanese NGOs, through the businesses, to, in each of your domain, keeping this issue of AIDS alive, but also making sure this creating these synergies and raising the voice. And I think also making sure that Japanese public opinion is aware of that. Because the country, okay, is a big market, but it's from export that you are prosperous also. And so you need to be connected. I think there's a lot, but it's not that it's not all or nothing. But
I see. Well, I'm not really sure you're familiar with the situation of the people living with HIV and AIDS in Japan. Do you hear any? Do you hear from your friends how people with HIV are living in Japan?
Yes, I do. And I was last weekend. I participated in the annual conference of the Japanese AIDS Research Society, and yes, and I have some friends who are living with HIV here in Japan.
They're complaining about
still a lot of discrimination.
Yes.
I think most people, AIDS is invisible in Japan because people are underground, because they're concerned to be open about it, because they may even, well, maybe you lose a job or so, and so there is an issue, and that's. I was thinking your previous question about Japan internationally, but I think good practice starts at home, and so that's very important. That this kind of there needs to be far more inclusion and acceptance of anybody, but also. What I learned at that conference is that there is quite a serious increase in number of new infections of HIV in Japan. Of course, this is not some of the countries that are heavily affected, but there is no excuse. It's mostly a lot in gay men who have sex with men, a lot of young people, and so that's something we cannot be blind for that. And every new infection is one infection too much. So it's a combination of this awareness about new infections, but also about the discrimination. That's not acceptable.
Well, I'd like to go on to my last question. Will we able to prevail over AIDS, or are we ready for new epidemics to come?
We will continue to make very good progress against AIDS, provided that the money is there, because we're becoming more efficient. Now, there will be new epidemics coming. The most obvious one, new flu epidemics, influenza of all kinds. And there will be new viruses. In my short life, I think there are like 50 or 60 new viruses that have been discovered affecting humans, animals. Are we prepared? I think we are better prepared than before, no doubt about it, because of better laboratories, faster techniques, and so on. But Japan needs an infrastructure that it doesn't have at the moment to work on dangerous viruses, so-called Category 4 laboratory. There is one, but it's empty, it's not used because of people concerned. The country needs that. And so we are prepared and we are not prepared, because it always comes very unexpectedly, but we are much, much better off today because we recognize the problem much faster and we can act much, much faster.
Thank you very much. I hope you've mentioned whatever you wanted to say today, but
Yes.
but we would like to continue with the next session. Thank you very much.
Thank you very
Dr.
much.
Piot.
ピヨット先生、大村さん、ありがとうございます。
Thank you very much, Dr. Piot. Thank you very much, Ms. Omura.